Hey guys, I promise you this is the last one for hematology, and it's going to be a rather short one, okay? We're going to talk about phlebotomy. Yeah, y'all always love to stick each other, right? Bear with me while I get in on this Okay, phlebotomy means sticking to good practices, guys. Not just sticking, but sticking to good practices. The thing that you want to hear your patient say the most is, I didn't even feel it. Okay? That's probably going to be the nicest compliment that you can get from your patients is when they say, well, I didn't even feel that. When collecting blood for laboratory tests, your goal is to get a representative blood sample with minimum discomfort to that patient, okay? You're going to do this, it's all going to hinge on the site you choose, the needle size that you select, and the equipment that you use, okay? When collecting blood for laboratory, your goal is to make sure, remember, that you use best practices as well. Okay, here's the equipment you're going to need. You're going to need a 2x2 or cotton balls, preferably a 2x2. Alcohol or appropriate prep. Some of them are going to the chlorhexidine. A 22 to a 23 gauge needle for syringe or tube holder. Your 22 is ideal for most punctures. Okay, a variety of tubes, whatever the doctor has ordered, and we're going to learn about tube colors and the orders to do them in as well. Your tube holder for your vacuum assist draws and butterfly set with the winged infusion sets. It has a little tiny small straight needle. They're using those a lot more, and you will be learning how to use not only the vacutainer but also the butterflies. You're going to need tourniquets, bandages, gloves, of course, a sharps container, and whatever your collection of tubes are going to be. Okay? Now, the tubes are filled in a specific order. Okay? Your blood cultures are filled first. Then comes the red, then the blue, then the yellow, green, purple, and gray. If you want to fill them with the proper amount, a lot of the labels are marked. On the printed label, it tells you where the fill mark is. Blue tubes will have a black fill line on them for you. Okay. On that label, you also are, well, at our hospital here, I don't know about other hospitals, but most hospitals, you want to pull one of the patient's stickers and put it on that tube as soon as you get it filled. Okay. That includes their name, their hospital number, date, time, and initials. If you do not have labels, you will put a little sticky label on there that has all of that information for them. Remember, you have a 2-stick limit. You only try them twice. If you can't get it the second time, you get somebody else to do it. Okay? Can any healthcare provider be trained to draw blood? They sure can. A lot of hospitals do cross-training programs where CNAs and phlebotomy go hand in hand, okay? Like I said, remember the order of your tubes, and you will see this on your test, okay? So let's go on to this. The tubes, blood cultures are not on this list, but, blood cultures are bottles that have special chemicals in them, and they will be drawn first. Okay? And then you're going to do red, and for those of you that are visual, I have put some colors up here to help you. Okay? You might want to make you up a little saying so you can remember them in the order that they should be done. Your reds are your chemistries. There are no additives in them. And then you have your blue comes next, which is your PT and your PTT. Your yellow is for electrolytes and glucose. Your green is your troponin. Purple is for your CBCs, your cross matches, citrates, reticulocytes. And then your gray is your blood alcohols. The order and color of tubes can vary from institution to institution, so you need to make sure that you're aware of of your institution's policies and procedures, okay? The reason why you have to give them or fill them in this order is because of the chemicals that are in the tubes, okay? Some tubes have chemicals, and you might have a residual from one tube to the next on that needle, so you need to make sure that you put them in the proper order. Carryover from one tube to the other tube can affect your testing results. Like if you do a purple top, which has an anticoagulant, if it's drawn before the green top, then you're going to get a different coagulation factor on your, and it's going to increase your potassium results as well on there. So I didn't know if y'all would know that or not. Okay, blood cultures. You're going to prep that site with chlorhexidine. You're going to make sure that it's not touched afterwards. Of course, that's just good aseptic technique. But make sure that the patient doesn't reach up as well. The only way that you can touch that site again is if you have on sterile gloves. You need to ensure that you use that chlorhexidine and you use it in the appropriate manner. It's not circular, it's up and down, and it's vigorously. Let it dry thoroughly. If you're drawing it into a syringe and you have to put it into the bottles afterwards, you need to make sure that you use sterile procedure on this, okay? It's important to not go above the optimum amount that is on the bottles, okay? So if you do, it can produce false results in your patient's lab works. 8 to 10 milliliters of blood for each bottle in adult. The minimum is 3. Your pediatrics, the optimum is 3. The minimum is 1. Half of that specimen is going to go into anaerobic bottle, and the other half is going to go into the aerobic bottle. Okay, you have 2 bottles that you're drawing to. Okay, let's talk about hemolysis. What can cause hemolysis? Hemolysis is excessive stress that is placed on the red blood cells that causes it to break. It releases the hemoglobin and other intercellular components into your serum and your plasma, such as your potassium, okay? So if you hemolyse it, their potassium is not going to be accurate, okay? You've got several rules of thumb here to do with this. Rule of thumb number 1 is mix very gently with inversion. Do not shake it, okay? Your blue and your red top tubes are inverted 4 times, very slowly, okay, after collection, and the others are inverted at least 8 times. Rule of thumb number 2 is keep the tubes capped and deliver them to the lab within 2 hours of the time they are drawn. And the reason why I say, and don't think, oh my word, in the hospital it'll take you 2 hours to get them down there. This is also for nursing homes. They pull their labs and they have to get them over to the hospital or the lab that is going to run these for them within 2 hour time period, okay? Rule of thumb number 3 is always call your referral lab if you don't know what tube to put it in, okay? When in doubt, check it out. Call the lab. That's what they're there for. Rule of thumb number 4 is always fill your blue top tube to the line indicated on the label. If you don't get the first tube to the line, you need to draw another tube, okay? Because they're not going to have enough. It's about 3/4 of the way full is what you need, okay? Other tubes you can fill up higher than that. It's going to yield up to 4 tests in each tube, okay? Now, tips on your blood draw. I mean, everybody has their own, and y'all are already LPNs, so you have your own style. So, I'm not saying it's bad. I'm just giving you some alternatives if you're somebody that kind of struggles with this. Best practices is you don't draw blood from an arm where an IV is, of course. Now, that's one thing we are going to be insistent on. If you don't have another option than to draw blood from an arm that has an IV, you know, you need to shut it off for at least 2 minutes. Okay? You need to follow your facility's policy for this, but shut the fluids off for 2 minutes. That way you don't get false reading, because IV fluids are concentrated in your blood specimen. Okay? To avoid some do's and don'ts that you need to follow with each system, and the benefits and drawbacks. I'm going to go through a little of these with you right now, including the safety, the cost, and the ease of use. Let's say syringe. Okay, that's your number one. Use a syringe instead of a vacutainer if you've got fragile veins. All right. A syringe enables you to control the vacuum pressure. Okay, so if you have a fragile little older adult, you might want to use a syringe instead of that vacutainer. Vacutainer can cause them to blow just bigger than anything. Okay, if the needle is not completely in the vein, the blood's going to fill that barrel of that syringe too slowly. Excessive pulling pressure on that plunger can hemolyze the red blood cells and render your specimen unacceptable, and the lab will be calling you, having a fit, and telling you to draw it again. Okay. One of the benefits of a syringe is that it is affordable. Okay. The other benefit that you will see with the syringe is you're going to get that flash that you're not going to get if you're using a vacutainer. Okay, so if you have difficulty, if you haven't done a bunch of blood draws, you might want to do them with the syringe so you could see that flash and know when you are in the vein, instead of wasting a lot of tubes, because once you put the tube on that needle, it's lost its vacuum. Okay. The big disadvantage of using a syringe is that there are a lot of accidental needle sticks out there. Okay, a lot of them don't have the safety feature on them that will protect you from that, or you can't use that safety feature when you're pulling it out of that patient's body. Right? Now let's talk about the butterfly or wing infusion set. Okay. It's very lightweight. These are your benefits. Its design makes it easy to manipulate. The wings give you a little something to hold on to. You can go in at a lower angle. You have a little greater control over your insertion. Okay? You get that visible flash that you do with the syringe. What are some of your disadvantages of it? The cut of the needle is one disadvantage. It's more blunt than your other needles, so it's a little more painful. They're more expensive to use. They're too short to reach the deep veins, so if you're going to have to go deep because all they have on top is spider veins, you're not going to get it with a butterfly. Okay? And they are also associated with a higher risk of accidental sticks. Now let's talk about the vacutainers. You don't want to use these on fragile veins because that vacuum pressure will collapse your veins. You can use them in the AC space really easily. The use of the tube holder does not allow the collector to control the vacuum pressure. I mean, the pressure's the pressure. Okay? And so you tend to have vein problems with those. Most of the needles now, they come with the safety on them. So once you pull it out of the arm, you just activate the safety device. Okay? Let's give you a few tips here for flawless phlebotomy. You want to review your policies and procedures at your facility. How they do it. Never draw blood on a patient who's standing up. Duh! They might hit the floor on you, right? Be sure to collect timed specimens promptly. Okay, so watch your orders. Make sure that you get them timely to the lab. Choose your AC space if at all possible. Don't choose those hand veins unless you can't find anything in their AC space. Number one, they're more painful, and number two, they're harder for you to get that vacutainer on and not rupture your vessel. Okay? Like I said before, don't stick them more than twice, and terminate it if you get a hematoma. Okay, do not draw hematoma blood into your tube and send it down to the lab. And don't, by all means, go fishing on your patient. No excessive probing. That's not nice. You wouldn't want it done to you, and don't do it to anybody else either. Okay? Now, let's do some tips for CVL blood draws. You know you're going to stop your fluid, okay, before your blood collection, same as the other, about 2 minutes. You want to pull up and waste 5 cc's of blood. Just throw it away. And if they're on heparin or anything like that, if you're doing a PTT, you're going to throw away a whole 10 cc's, not just 5, okay? Make sure there are no fluids being infused. You want to flush that line, okay? If they don't have any fluids infusing, you want to flush your line with 5 of normal saline, okay? And then you waste 5, okay? So what I'm saying is, if they are hep locked off and you go in to do them, you're going to take 5 cc's of saline. You're going to push that in first, pull back 5 cc's of blood and waste that, and then do your blood draws. Okay, remember, you need to practice your various techniques. You need to make sure that you are aware of the policies and procedures of the place that you're working in first, and review them before you go to do the blood draws. Tips for using your excuse me, vacutainers. You want to gather your equipment, wash your hands. Okay, tighten that tourniquet above the vein. How far above the vein do you go? About 6 inches, correct? Okay, you want to clean that site per policy. Like I said, if it's chlorhexidine, you go up and down. If it's alcohol, betadine, alcohol, you want to go around and around, okay? Choose the best needle for your patient. Put it on your adapter, okay? And you want to use a smooth, steady motion to access that vein. Go in at a 15 to 30 degree angle. Do not go in any higher than that, okay? When you feel that vein pop, then you are going to hold firmly to that vacutainer and push the stopper onto the needle, okay? You want to always make sure that you hold on to that vacutainer securely, or you will push yourself through that vein, all right? Now, I've got some YouTubes here for you that give you the different ways to draw blood. Okay, so if you haven't got a lot of experience, please look at these. And the last slide is everybody's going to stick before you leave. Okay, and so you will be doing this on your, I believe it's your first day of clinicals, if not on your simulation lab. All right, I hope this helped y'all with your blood draws. If you've got any problems, or if you need any help with this, just let me know. I'll be glad to help you as always. Okay? Now see, that wasn't bad. It didn't take very long to get that one done. Thanks. Y'all have a good week, and we'll see you at simulation.